will come with a good recommendation for the kingdom about this collaboration, not only for pediatric GI and allergy, immunology, and so on. So the topic was selected by the organizing committee to talk about the prebiotics and probiotics, microbiota, etc. And this is a good topic because there is more going on, and this is a hot topic nowadays. Today we'll talk about it, and I think Yazan has tomorrow to talk about it. Dr. Saleh mentioned about the microbiota, so I hope we will go over it in the next 20 minutes. So what is prebiotic, probiotic, postbiotic, symbiotic, and so on? There's many terms, you can see them here and related to the in the market nowadays. And we need to know what are each one of this, or what's each one of them, so we can know where can apply it. I was in the States, and I was one of those who started that in the prebiotics in the 95. I was in Omaha. We worked on the probiotics at that time from the GI point of view, where we used the probiotics for kids who have gastroenteritis, rotavirus, and so on. And then we started to see more nowadays in the allergy and immunology and still in the GI. So it's not the topic to talk from the GI point of view. I try to mention it from the allergy and immunology part of it. So talking about the gut, which most of the things are going on, and always I tease Yazan that what is more important, the GI or the respiratory system. We always end that both of them are important. But I think the GI is more important because without it we cannot survive. So in our gut, there are millions and trillions, subhanallah, of microorganisms. And these microorganisms are non-pathogenic, they are healthy. And they are important not only they are staying there, but they are important to make some vitamins like vitamin K, biotin, thiamine, folic acids, and they can interact with our immune cells in our system, and they can maintain our epithelium in the gut healthy as much as possible. At the end, they will have competition with the pathogenic bacteria, so they will be persistent and they will survive all of this. So the microflora of our gut, which colonized in the first weeks of life, Dr. Saleh mentioned about the RSV and the breastfeeding and so on. So these colonizations started as early as the first weeks. And we thought that the gut is sterilized, and it's nowadays say no, there are some microflora or some bacteria in the gut even before the baby started feeding, which can happen in utero through transplacental and swallowing and so on. So these microbiota or microflora started early in life, and then they continued. And this micro has a good influence that they will resist infection, and they will improve, or they may influence the predominance of T helper 1 and T helper 2, and they may alter the gut microenvironment by changing the types of the microorganisms that are present in our gut. And this is the first one, which is the probiotics. They are live microorganisms. So they are not dead, they are a live microorganism, which upon ingestion in sufficient amount, they will exert health benefits on the host. And this is many years ago that had been published by the WHO and even earlier. And the common one we know about now is lactobacillus and the bifidobacterium that are available in our gut. So simply, if we define what is probiotics, they are a live microbial food ingredient that is beneficial to our system beyond its nutritional properties. That's a simple definition of the probiotics. So they are living microorganism within a food that is designed to provide health benefits beyond the food's inherent nutritional value. And these types of microorganisms, or the probiotics, have certain characteristics to be of any value. They have a benefit within our bowel, and they may be capable of living within the human without causing any harm to the host. Subhanallah al-Azim. So if I ask you one of the questions, this is a common, what do you think the total weight of those microbiota in our humans? Do you think it is like 10 grams total? 200 grams, 500 grams, or 1 kilogram? 10 grams. 1 kg. مين كمان 1 kg بيحكي؟ تمام. Good answer. So you can tell how, if we weigh the solid weight of those, they are more than 1 kg. Good answer. برافو عليك. It's estimated between 1.2 to 1.5 kilogram of the microbiota that is available in our system. More than 10 times the total number of cells in the body. Those are the microbiota. Around 100,000 billion, which is around 100 trillions. You see how much treasure we have in our system. Walillahi alhamd. We cannot value. 100 trillion of bacteria, healthy bacteria, is found in our gut. And if we look where they are mainly, do we have, I don't know, it's working kind of? Oh, the pointer? Okay. Thank you. So not much in the stomach because we don't need it. And the stomach is simply a pass, it's a reservoir. We don't have much digestion going on in the stomach. So they are less than 10 to the power of 3. So around 1,000 per cubic or cells unit per ml. In the duodenum here, we do not have much either because again it's a tube that passes food. But they start to accumulate more in the small gut, in the small bowel here, around less than 10 to the power of 5, ileum to the power of 5, but the majority of them are sitting in the colon, whereas in the trillions. So those bacteria are simply found in the large intestine. And the common one, as I mentioned earlier, the lactobacilli, which are from the Enterococci family, Enterobacteriaceae family, and the Bifidobacterium, which is the Peptococcus, if you remember those, we learned them in the school early, Peptostreptococcus. These are a healthy kind of bacteria that colonized our large intestine. So this effects of the probiotics in our immune system and our immune response is beyond the talk right now, but the importance of these they are repair of intestinal barrier function. And they are important for the tight junction between the cells of the gut, which is the small bowel and the large bowel. They enhance mucin production, so always the gut is not dry. So there is mucus in the gut, and that's what will help us passing the food and the gut and the waste. They are important for the dendritic cell function, so they play a role in the motility of the gut, as well as they are important for the T helper, rather T1 more than TH2, and then they can suppress the intestinal inflammation. So in the small intestine, lactobacilli. In the large intestine is the bifidobacteria that are in a large amount. They are resistant to heat, humidity, as well as limited oxygen availability. This is the quality. They resist the gastric acidity, and they resist the biliary salts. So subhanallah, how those important, these bacteria. Because any pathogens can be killed the first step in the stomach because of the low pH of the gastric. If not, by the bile salt, which is high alkaline salt. But they survive in the human and even given orally, and we can find them in the stool if we test for those bacteria. So some role had been proved over these years. I said I started that in the 90s, and there are many publications had been used to show the importance of the probiotics. In diarrheal disease, rotavirus showed you can decrease the span or the period of the infection by the gastroenteritis for a shorter period of time if you give probiotics. Had been used in the IBD, Crohn's and ulcerative colitis. Had been used recently in the IBS, irritable bowel syndrome. Had been used now for functional abdominal pain or RAP, recurrent abdominal pain. Even in cancers, to lower cholesterols, in prevention of allergic disease, eczema, which I will show you later on, and for lactose intolerance. So there is a lot going on those probiotics and so on. Where they available, those probiotics? They can be available in the yogurts, and I'll show you some of the yogurts that are available in the market, in the fermented milk, some fortified juices, as powders or capsules, as tablets or spray. And what available in our market in Saudi Arabia, something called Biogia, In the States, something called cultural and others available form of probiotics. What is a prebiotics now? So we know about the pro, now it is a pre. The prebiotics is a substrate that is selectively utilized by the host microorganism, conferring a health benefit. And this is the one you may hear it is available now in the milk formula in the market. They are non-carbohydrate substances. They body sites other than gastrointestinal and can benefit health, and which had been documented. One of the many prebiotics available now in the market called HMO, or human milk oligosaccharides. Human milk oligosaccharides, and I'm sure you found them if you read the ingredients of the formula available in the markets. Without mentioning, but just generally speaking, Nestle, for example, Similac, for example, and so on. Those are non-digestible food ingredients that stimulate a limited number of bacteria. And these are the two common ones they are available in the market, the FOS and the GOS, fructooligosaccharides and the galacto-oligosaccharides. And they can be provided in the beverage, can be in the healthy drink and spread, in the cereal, in the cake, as well as in the food supplement. Those are the common one available as prebiotics nowadays, FOS and GOS. What is postbiotics now? They are metabolic byproducts that generated by probiotic microorganisms that influence the host biology. So probiotics, prebiotics, postbiotics. What is symbiotics? They are a combination of the pre and the pro, are mixtures of probiotics and prebiotics that benefit the host by improving survival and implementation of live microbial in the GI tract. And now it's available also in baby formula in a certain formula, not all of them. They combine pre and pro, and for example, there will be bifidobacteria with prebiotic, which is the FOS. So you combine the pro, which is the bifidobacteria, and the pre, which is the fructose oligosaccharides or the HMO. To establish the new species need to continue life culture and appropriate substrate. What is dysbiosis? That's another last term you will use, which is the imbalance between disease, antibiotics, diet, and so on. So let's talk about, because this is the presentation about the allergy and the infection and so on. Now, in the intestinal flora, where the prebiotics that available, and the GOS and the FOS, the galacto-oligosaccharides and the fructo-oligosaccharides. And the amount around 0.0 gram per 100 ml, the oligosaccharides. They used it here in this study in the preterm and term infants, and they measure the fecal flora. And here they depend on the short chain fatty acid, which is available in the large intestine. So what they found that significantly the number of those bifidobacteria increased, and the number of pathogens had been decreased significantly when they introduced this kind of prebiotics. And to prove it, they found that the fecal pH also decreased because of the acidity, and they conclude that the prebiotics play a major role as a modulators of postnatal development of immune system in the babies who provided prebiotics on those one. I'll skip that one. So the trials had been used on pre and probiotics for those to see how they affect on allergy and immunology of the babies, term and preterm infants. They found not all probiotic have tested in clinical studies. They tested lactobacillus group, which is the Bulgaricus, seemed to have no effect on the immune system. The acidophilus has accelerated recovery from food allergy symptoms, and they have also been observed in infants with eczema as well as cow's milk allergy by using the Lactobacillus rhamnosus. So these are many of those species of the probiotics. In eczema, Dr. Saleh mentioned slightly about RSV, and he's skipped it because of this talk. Pregnant women, they took capsules that contain Lactobacillus rhamnosus, or LGG, which is one common during the last 2 to 4 weeks of pregnancy, and they found the newborn infants were given the same microorganism from birth to 6 months. Breastfeeding mothers continued to take the capsule during lactation period, and the babies were given bacteria mixed with water by spoon. And then subject taking the probiotic had a reduced risk of developing atopic dermatitis or eczema compared to control up to 4 years of age. Other studies found no reduced incidence of eczema in babies treated with the probiotics. That was published in 2003. So in eczema, can probiotics have any role on that one? If we supply, and that's one Finnish study and was published almost 10 years ago, if we supply pregnant women with first-degree family history of atopy with Lactobacillus GG for 2 to 4 weeks before delivery, and they follow it for 6 months, those babies. At 2 years old, the eczema prevalence reduced from 46% to 23%, with the confidence value around 0.32 to 0.84. At 4 years, the relative risk reduction for atopic eczema of 0.57. And at 7 years, the relative risk reduction 0.58 with 95% confidence. That was published in Journal of Allergy Immunology around 10, 12 years ago. Dutch, they did a randomized double-controlled blind study using Bacteroides and Lactobacillus also, to pregnant women and to babies for the first 12 months. And they found decreased risk of eczema with active treatment at 3 months, 6 out of 50 versus 15 out of 52, but it was not significant. The p-value was around 0.035. And at 12 months, around 50% versus around 31 or around 40%. So what we can learn from this in our respiratory system, this is published also years ago at 12 weeks of using the Lactobacillus retori, which is now available in the formulas in the market. There is a significant reduction favoring the use of lactobacilli, that the days with fever reduced, the episodes of fever reduced, and the antibiotic prescription, as the question was asked early, was reduced by cutting down on the frequent infection. There is, looking at the first 6 months of age, what is the role on the allergy, that the mixture of GOS and FOS and the incident on atopic dermatitis, a prospective randomized controlled trial, double-blind placebo, on 259 babies were done with high risk of atopy. And they gave them 50-50%, 80 grams of GOS per liter of GOS and FOS, and the rest, or the placebo, was maltodextrin, which is the same sugar, but has no prebiotic in it. And they found in that first 6 months, they used hydrolyzed protein formula, which is hypoallergic formula, like HA form. And those groups had been 98% infants. They analyzed the fecal flora for those babies, and they found that the atopic dermatitis compared to the intervention to placebo had been reduced significantly to 98% to 23% in the high-risk group. And they found increased significantly the number of fecal bifidobacteria, and there was no significant difference in the lactobacillus count. When they mixed those, the prebiotics, with this short chain and long chain one, and they compared to the human milk oligosaccharides with this prospective study on those babies, that the number of infection requiring antibiotics had been reduced, and the incidence of infection also had been reduced significantly. And this is, and the upper respiratory tract infection had been reduced, and the frequency of antibiotic use, and this is reproduced in the Journal of Nutrition, again, compared to the previous one. So they found the cumulative incidence of any recurring infection had been reduced to around 4% compared to the 14% without the use of the prebiotics. So the prebiotics, they concluded, decreased the number of infection and the incidence of recurring respiratory tract in the first 6 months of life. Now, on the long-lasting now, they look at the mixture of the short chain GOS and long chain FAS, and on the atopic dermatitis, and protective effects had been questioned, can last longer or cannot last longer. So what they did here, they did a study, again randomized controlled double-blind placebo on term infants, and using the same hypoallergic formula as, 50% they use prebiotics of GOS and FAS, and the other 50% they use the maltodextrin. And they look at those patients in another study, and they follow them that the endpoints, the primary is the cumulative incidence of allergic manifestation, and the secondary endpoints was the number of infection and does it have any role and so on. And the intervention, when they look at 2 years of age, that the atopic dermatitis in that group decreased, the recurrent wheezes decreased, as well as the urticarial decreased compared to the placebo patients who did not receive the FAS and GOS and only depended on the use of the maltodextrin. Okay, so what happened? That fever decreased, antibiotic prescription decreased, as well as the former and the upper respiratory tract infection. So these are many of the systemic review had been, and they found there is risk of atopy decrease and so on. I will try to skip and come to the last point. Can the prebiotic has any effect on the immunoglobulin in our system? Again, they did the study and was in Netherlands, around 84 children, and they use hypoallergenic formula, and they use the prebiotics, and they look at those babies who received the DTP vaccine. And at 6 of the months, they measure the cow's milk protein, the total immunoglobulin, as well as the immunoglobulin of the secondary DTP. And they found here in this study, significant drop in IgE level, significant drop in IgG 1, 2, and 3, but no effect on IgG 4, and the cow's milk protein, IgG 1 also significantly dropped, but did not affect the vaccination, which is the DTP. And they concluded that using the prebiotic GOS and FAS has decreased the total Ig response. They modulate the response towards cow's milk protein, and the intact for the vaccine was intact, but it is a good method to restrain atopic march, and that was a study. So this is just to show you what is available in our market. If someone asks you what are the prebiotics we can use or probiotics, Activia, for example, is the milk available. We can find it in all supermarkets. And what type of bacteria? The Bacteroides group here. Prayers, this is more in the States, but I see it in Tamimi here. They have Lactobacillus acidophili. Danone group, this is Tonfield French yogurt, vanilla, etc. They have the Bifidus and Lactobacillus acidophilus, and the U+, which is not available here, but it's in there. Also, this is another group of bacteroides. So in summary, and we'll finish. So remember the terms, the pro and pre and post and symbiotics and dysbiosis. The prebiotics is mainly large amount in breast milk, which is the GOS, galacto oligosaccharides, more than the fructo oligosaccharides. The bifidogenic effect, they improve the flora and they enhance the good bacteria in our system. The prebiotics are good, and we showed you how the drop in the infection and the allergy, it can be tolerable in the GI tract, and the stool characteristic can improve, which I didn't show you, that it will be soft stool and it will be healthy bacteria still in that stool. Safe in the term and preterm, that's why you find it in the ready-to-feed formula, as well as in the formulas, as well as in the added food like cereals and so on. In the GI, it's tolerable, and it has many other effects. So the take-home message from this, that there is a lot of evidence that published and that are good for infectious diarrhea. We use it, and it decreases the span of the bacterial or the viral and bacterial infection by probiotics. It has good for the mortality prevention of NEC, necrotizing enterocolitis. There is more promising evidence of prevention of atopic dermatitis, even in constipation nowadays. In the future, we may be using probiotic as we use antibiotics today, with the specific strains for certain clinical situation. The prescription that we need now available is the lactobacillus. GG are the best studies now, which are available in the biogear, in the cultural, and in certain form you can find them in the healthy markets. The combination products not well studied yet. 10 billion organisms can be, or trillions. When you prescribe it, keep it refrigerated, except the cultural, which comes in powder, and can be given in cool and cool food and drink. And there is just bloating and gases are the major side effects or withdrawal in this one. By end, thank you so much, and I wish we have more time because this is a huge topic. You can take one piece, you can spend an hour on each one, but thank you for listening.